with Stephanie and Nalie. I'm Nalie.
And I'm Stephanie.
And today is episode 13.
And today we're going to talk about all of the conventional drugs and treatments that we have both taken over the years, as this is a question that we get a lot in our inboxes and our DMs. People want to know as they're starting a new treatment, have you taken this treatment? Have you taken this one? What are the side effects? So we thought it'd be the perfect time to explore and explain all of that in today's episode.
Because Steph's been on her journey for like 9 years. I've been on my journey for 6 years. We have taken a lot of conventional treatments and medication, and there's no better platform than a podcast to finally give you a summary of it all. So without further ado, here is episode 13.
Wow, episode 13.
We're on a roll.
We are on a roll. Time flies.
Insane.
So I hope everyone had a wonderful new year and everyone's starting off their 2020 on a good note.
How's yours going so far?
Well, ironically, it's been great, but ironically, what perfect time to do this episode. I just had treatment yesterday.
Yeah.
So I'm like on the mend. So if I sound a little out of it, I'm definitely a little out of it. But yeah, but other than that, everything's been great. Just really looking forward to all the things that we have in store.
Yes, same. And I'm so glad we are recording this episode because what we try to do with Thriver Talks is give you topics based on questions we get often in our emails and our DMs. So one big question we get is what treatments are you girls on anyway? And what treatments have you been on knowing you've been living and thriving with stage 4 metastatic breast cancer for so many years, yet you girls look so healthy, and you would never guess. That's one, I know if it's the same for you, Steph, but so many people always tell me like, oh my God, you would never guess that you've been through half of what you've been through.
Yesterday, actually, the nurse that was giving me my treatment, she was like, how long have you been on this for? I'm like, well, this particular drug, about 3 years, but I've been on nonstop treatment for 9. Insane. And her jaw just like dropped, and she's like, you look amazing. How is that possible? So even the nurse was like, couldn't believe it. So
yeah, no, exactly.
It's pretty crazy.
It's very, it's flattering, but at the same time, it's like in terms of spreading awareness, I think it's important that we lay out all the medication that we've ever taken on the table and be honest and admit that, it's been really, really hard. I mean, like we've covered in previous episodes, all our alternative complementary therapies, everything that we've done to assist with our healing and coping with side effects. But we realized we're like, you know what? We never really even mentioned what drugs we've been on.
Yeah, it's true. It's true. And they have played a huge role in getting us to where we are today.
Absolutely, undeniably.
And I personally believe in the perfect marriage between East and West.
Same.
I do think that, drugs play a huge role in our healing, and that a lot of the complementary therapies that we do, I do believe heal, but sometimes they even help with the side effects of the conventional therapy. So I think finding like the perfect marriage of the two of what works for you is always my best advice.
Absolutely. Finding the best from the West and the best from the East, and, finding what helps for your unique individual body.
It's true. It's so true. We all react to things differently, just like, someone may love a certain food and another food makes someone nauseous. It's the same with treatment. And, so to kind of like kick off the episode, I've been on so much stuff, and luckily I've never really had really harsh side effects, which is pretty amazing. I'm kind of amazed at myself sometimes and just give so much gratitude to how resilient my body is, because I've been on so much stuff. And should I just go ahead and kind of start with some of the first drugs I ever took?
Yeah, as always, let's go in chronological order. And I think you were diagnosed before me. And I think what's important about going in chronological order, which is why I'm very happy we're recording this episode, is that there were drugs that didn't exist nine
So
years
true.
ago. And there
It's
were,
so true.
in fact, the drug that I'm currently on was only newly approved like a couple of months ago. So even us giving you this summary of what we've been on, hopefully will perhaps, give an option to someone all around the world who's living with MBC, or who knows someone who's living with MBC, and will give them, that drug and that therapy as an option. Because I know you have done that for me, Steph, being a Canadian and you being from the States. There were certain things that you were on that weren't even approved in Canada yet. So hence why I think we definitely should start with you to and which
I
year was
am your
that?
guinea pig.
Yeah, you've been my guinea pig for the past 3 years.
Oh
Thank
my
you.
gosh.
And in turn, I've been a lot of like tens and thousands of women's guinea pigs. So,
Amen. You're passing it down. You're passing the
yeah.
torch.
So,
Oh
what
my
year
gosh.
did all this start for you again?
So, if you guys go back, I'm not sure if you guys have listened to episode 1, Nalie and I really
Mm-hmm.
go into detail about our personal stories, and I don't want to talk too much about that, a big part of my story today, but if you go back and listen, you can hear it very thoroughly. But I was misdiagnosed for the first 4 years. So I was on the wrong treatments for the first 4 years of my, actually 4.5 years of my now 9-year journey. So a lot of the drugs I was taking, I initially was diagnosed as being ER positive, HER2 positive. And through a sequence of events and divine intervention, I uncovered that I was never HER2 positive. But for 4.5 years, I was on HER2 positive treatment.
Ah, it
So
makes me mad
crazy.
every time I hear it.
It's so crazy. So the first drug I ever took after I did my 3 lumpectomies, got my diagnosis of being HER2 positive, was Herceptin. And Herceptin is specific to HER2 positive. It's I think I want to say it's like in the chemo family, but it's not a harsh chemo. I remember my oncologist telling me, these are not my words, but saying that, a lot of women, are wishing that they were HER2 positive because they have access to this great new drug at the time. It was
Mm-hmm.
Herceptin. It was brand new. So I was on Herceptin for about 4.5 years. Every 3 weeks, I would get an infusion. And with the Herceptin, because I was also ER positive, I took tamoxifen, which was hell for me. Have you taken tamoxifen?
I did actually. Tamoxifen was the drug I was on during my years of remission. That unfortunately did not keep me in remission because I got the recurrence. But I didn't really experience the side effects that you're about to mention.
Yeah, and I mean that just goes to show we're all so different. But
Mm-hmm.
for me, so I took the Herceptin, it wasn't working, and now I know why, because it wasn't the drug I was supposed to be on. And I was taking the tamoxifen, which was making me just really not myself. Even with cancer, I've always been kind of like an upbeat, positive person. And tamoxifen was just making me cry, angry. I mean, I would literally cry because I couldn't find something to wear. It was just like, it just made me really emotional.
Well, depression is
Um,
part of the side effects that they mention,
Oh
right?
yeah, it was bad. I actually, so when I moved to my next hospital, I told my new oncologist, I just said I can't take this. Like this is no way. Like I can't live like this.
Mm-hmm.
So she switched from tamoxifen. She put me on Lupron, and fast forward to today, I'm still on Lupron.
Mm-hmm.
So Lupron is just another hormone blocker for ER positive cancer. And I get an injection. I think you can either get it monthly or tri-monthly. I've done both. I did monthly. Then I went to tri-monthly and back on monthly now. So when I started with my new oncologist, I started with Lupron. She knew I had been on Herceptin and it wasn't working, so she said we need to incorporate chemo immediately. Um, and the first chemo I ever took was a drug called Navalbine.
Mm-hmm.
Um, and I remember this was like a really harsh chemo. I didn't understand at first because when I would go into the chemo suites, I'd see, women plugged up for hours with a drip IV. And this chemo, literally, I remember the nurse would come in a paper suit, suited from head to toe, and gloves and a mask and have this giant kind of syringe with the treatment and would do a slow push. And I always wondered, like, why is my drug administered so differently, being that it's a chemo? And they said, well, this is so strong. Should, we're mandated to push the entire drug into you, because if for some reason the IV were to slip and it gets on your arm, you could lose your arm. And I was like, oh, cool. Like, what's it doing to my insides? I mean, obviously killing cancer was the goal, and it did. But, and I'm very stubborn. I think it's important to note that when I first was going to start the Navalbine, my oncologist said that I needed a port. I'm not recommending this. This is just my own journey. But I refused the port, and I did it through my vein, and I've used my same arm, same vein for 9 years. And
wow.
She's my old faithful. And I swore that I told my oncologist, she's like, your vein can collapse. And I said, well, if it collapses, then we'll do the port, but I'm trying my vein. And there were some times that I felt like the burn from the Navalbine, but I was so stubborn. And again, I don't recommend this. I just kind of thugged it out.
Yeah, and everyone's different.
Yeah,
I know you didn't want you'd rather like do that than have a port in you, I think is what you said.
Yeah, I don't even know why. That was just my personal choice at the time. And sometimes I think, God, life would be so much easier if I had a port over the 9 years, because I get poked and prodded so many times. But just the choices I made that led up to where I am.
Which all, again, proves that we all have a choice.
Exactly. All of our journeys are so different.
Yeah.
So I took the Navalbine, and I think I want to say 4 months worth of Navalbine, and the scans showed improvement. So I got to come off the Navalbine, stay on Herceptin, and then a new drug came out that was called pertuzumab, that was kind of a sister drug to Herceptin. It piggybacks it, so you take the two in conjunction with one another for HER2-positive cancer.
Mm-hmm.
So I was taking my Lupron, then Herceptin, and pertuzumab. And I think it's also important to note, that I never lost my hair with Navalbine.
Yep.
And so I did this new trio of the Lupron, pertuzumab, and Herceptin for about a couple years, until another mass started growing really aggressively in my chest. Again, if you listen to episode 1, you'll hear my story. I was sent home to pass, and then I went and found an amazing doctor at Maimonides, Dr. Borgen, who's the one that uncovered my misdiagnosis. And prior to my misdiagnosis, sorry, I'm kind of scattered because there's so many details. It's such a long story.
This is why like a podcast is necessary, because like, how do you even write this in a caption?
It's so crazy. Yeah, exactly. So right before she sent me home to pass, she was kind of in a panic. So, okay, well, the pertuzumab isn't working with the Herceptin and the Lupron, so she gave me a new chemo called CMF. New for me, it was not a new chemo at that time. CMF wasn't working, so then she put me, I believe this drug was new at the time, it's called TDM1.
Okay.
I took TDM1, wasn't working, and that's when I went to Dr. Borgen and found out that, okay, well, no wonder all of these drugs aren't working. It's because you're not HER2 positive. So, so crazy.
So crazy, which is why I was even going to say, like, I've never even heard of these drugs. And, like, I was going to be like, oh, but we have the same diagnosis. And then I remember, like you said, it's because you were misdiagnosed. And I never even tried any of those drugs before.
I think that's why, I can have, like, a lot of conversations with women on social and stuff, because I kind of understand both diagnoses, because I was being treated as such for such a long time.
Almost like, again, like a blessing in disguise, because, like, you can relate to, like, all aspects of breast cancer almost.
Yeah, it's true.
And now as the leader that you are, and as the advocate you are, like, helping other women on their journeys, it's almost like more than your average, woman diagnosed with a breast cancer diagnosis.
More than I ever wanted to know.
Exactly. It's like, didn't need to know that.
Did not ever want to know any of this. Could have read a book
instead, but okay, God.
But that's how I know exactly.
Mm-hmm.
That it's my purpose, because, sometimes when we go to these conventions, it's like I can hold a conversation with an oncologist and know about every drug they're talking about.
Yeah.
It's so wild. Okay. So back to when I finally, I guess it's, when I was finally on the right treatment. I always wonder, like, was this my first line? Because all these other drugs were, and also with Herceptin, if you're HER2 positive and listening, you know that with Herceptin, there are side effects to your heart. So in addition to taking the Herceptin, like every couple of months, I had to go get an EKG to make sure my heart was functioning properly. So anyhow, when I finally got the correct diagnosis, a new oncologist who knew what the hell he was doing, he put me on anastrozole, which is also known as Arimidex, which is a pill.
Yep.
I kept taking Lupron because of the ER positive to suppress my hormones. And he wanted to just kind of see what this combo would do. And it wasn't working by itself. And that's when I got, really, really, really sick. And that's at the time, what this is really interesting. When I first found out that I was misdiagnosed, Dr. Borgen was telling me about this drug that was in trial called Ibrance. And I'm trying to think of the other name for palbociclib.
Yes.
So palbociclib and Ibrance are the same, but he was calling it palbociclib. And he kept saying, you need to get this drug. It's not FDA approved, but we're going to do whatever we can to get you on this drug. But
what year was this again?
Oh my gosh.
Was it 2016?
Maybe like, yeah, exactly. I was just going to say
16?
4 years ago. It was about exactly 4 years ago. So when I moved back to Los Angeles, I started the Ibrance, palbociclib, and I have been on Ibrance ever since.
Crazy.
Not crazy. It's been 4 years I've been on Ibrance. So I have been on. So that kind of brings me to what I'm at currently. So I'm still on the anastrozole, which is the Arimidex. I'm on palbociclib, which is Ibrance. And when they saw the 2 spots on my lung a few years ago that we just found out are scar tissue, they incorporated Faslodex into my treatment plan. So as of now, today in 2020, 9 years into my journey, I am currently on, I take Lupron monthly, I take Ibrance, I take Faslodex, and I take anastrozole, which is Arimidex. And the only other thing I can kind of add to that is because I found out that those spots on my lung are scar tissue, I am taking a lower dose of Ibrance now. So I started out on 125 milligrams, and now...
Which is standard.
Yeah, I think that's the highest dose.
Yeah.
Then I weaned myself down to 100 milligrams, and now I'm on 75. And my goal is to kind of wean off of it, which we'll get touch on that in a later episode. But all to say, that's what I am on today, because I get asked this question a lot. And if you have asked me and I haven't responded, this is why.
Exactly.
It's like, how do I ever respond to this question?
I feel you. And even like for me, like listening to you say all that, and like I'm such a visual person, so when you started talking about like the navel being and the nurse like putting on her like radioactive suit on practically and like pushing it into your veins, like I gagged. I literally gagged and felt nauseous because it just brought back so many memories. And I'll be honest, the reason why I don't really like talking about, chemo and stuff anymore is because it triggers me in that sense where I kind of feel all the disgusting feelings, all the side effects that were really harsh when I was on it. And like I could practically taste it in my mouth right now as we're speaking about it.
Yes, or that taste, not feeling. Sorry.
Yeah, hence why I'm happy in the end that we are recording this. So every time I do get asked this question, I could just be like, well, there's episode 13.
Episode 13 of Driver Talks. That's going to be my new answer.
Seriously. So yeah, I'll give my crazy conventional treatment plan a shot right now, once and for all.
Yes, once and for all.
Yes, because I don't want to go back there ever again. But
exactly.
I guess my journey was started in 2013. That was the initial diagnosis when I was 24. Again, listen to episode 1 for the full story. But upon diagnosis, they were like, you need to start chemo right away. And so I did, it was 16 rounds of chemotherapy. I believe it was, the first was AC. And
Is that the drug that they call Red Devil?
exactly. That's why I even like hesitated even saying it, because
Yeah.
that was the harshest one. That's the one where you like lose your hair 2 weeks later, on the dot, like 14 days, your hair starts falling out in chunks. And it's like it's the heavy duty stuff.
Right.
And I remember just feeling nauseous and like even vomiting like the first time. Just my body was aching. It was like 1 week of like, you gotta be in bed and you're just not gonna be like yourself. Yeah, you're not gonna be yourself. You're gonna you won't be functioning as much. You should rest. That's what I always tell people now. Just like give yourself a week to just rest and do nothing. And obviously some treatments are not always like, some are different, some are better than others. And I remember like, as the more you do, the worse it gets, right? Like the more your body is affected by
your immune system
and accumulated, right? Yeah, the more you have inside you, and the more your immune system takes a toll. So yeah, I remember doing how many? I think 6 in total, if I'm not mistaken.
Rounds.
Yeah, and it was harsh. I lost all my hair, my body inflamed. I think I have to say that I had it like less harsh than your, I don't know, I don't like saying your average patient, but I do remember people being like, wow, Nalie, you're still like strong. I do remember running 5K after my 3rd round.
Yeah, that's
I did the CIBC
crazy.
run for the cure here in Montreal. I was the ambassador for a couple of years, and I like ran the 5K in like 34 minutes. And I think like that goes back to our past episodes about like what is a thriver. And the power of the mind. And yeah, but yeah, no, I just remember that being like the harshest one.
So and when you started that, sorry, just I've never asked you this. Did you like at that same time have to start a hormone blocker?
No,
just chemo.
No, actually, I lied. See, this is how like I feel like
putting it out of your mind.
Yeah. But I did, because I did Lupron, and that's because before my first round, I think I tell this story often. The beauty of like social media was that when I launched my blog, people were like, "Are you gonna freeze your eggs?" And I was like, "What does that mean and why?" I had no idea that chemotherapy had an effect on your fertility.
That's definitely another episode.
And no one told me that. And as a 24-year-old, of course, I had a dream of starting a family eventually. So thank goodness for being open about my diagnosis, because then I was able to go back to my oncologist and be like, listen, I do care about my fertility. So he postponed my first appointment and sent me to the reproductive center, where then they put me on Lupron, and they froze my eggs. And then I think I was on Lupron for prevention as well, because they say if you're not like, if your eggs aren't like, man, I don't know this theory, but
fertile.
Yeah, like it's almost like if they're not out, then they can't be affected by the chemotherapy. Do you know what I mean? So if they're like suppressed, they have less of a chance of like being affected, and you have less of a chance of being infertile after treatment. So I know I was on like hormonal blockers for that reason in particular. And then so I did after AC was Taxol. And I remember my hair was growing back a little bit. That's when I had the peach fuzz. And
so is Taxol another chemo? See, I have questions.
Yeah, okay. I know. Me too. I was like, when you were saying all these drugs, I was like, what is all that?
Same. Okay.
Yeah, Taxol is all intravenous chemotherapy. And I believe it's less harsh than AC. And but again, just different types of side effects. I feel like on Taxol, like I think they give you Benadryl, because you're like prone to like being allergic to whatever reaction. To whatever ingredient they have in particular in Taxol. So I remember going into treatment, and when it was Taxol, I was like, I would knock out. Like people would be like, you want me to accompany you? I'm like, if you want to watch me sleep, sure, because like
pick me up and carry me home.
Because I was like there's no like playing games and stuff, like you know, when you're doing chemo, because it could take like 3 hours. Like I would just like sleep. And then after that, I had a mastectomy right after. Did you never had the mastectomy, right? You never
No,
had the
my
surgery.
body gave itself like a
Yeah,
mastectomy.
and that's in
Pretty
episode
crazy.
1, right? When you tell that story. Did you ever get into
Yes.
it in episode
I
1?
don't know. You know, it's so funny as we're talking.
Mm-hmm.
Like, I'm like, hello, we have to tell our fertility journeys and
Yeah,
also
yeah.
like body image and things that have happened to our
Okay,
bodies.
so we'll save that for another episode.
Yes.
Yeah, like
Yes.
the whole surgical part of it all.
Yes.
But yeah, very good point. So keep listening, Thrivers. We'll definitely cover that in a future episode. But I got a total mastectomy of my left breast. Then I got an immediate reconstruction where they put the expanders, and then there was like that whole recovery process, and then the whole filling of the expanders for a year, I believe, until I or was it less than a year? Man, you know, by the way, in parenthesis, this is all on nalie.ca and my YouTube channel, Nalie Augustin. If you search for it, I documented my entire treatment plan, my entire journey, the side effects, in great detail. So if ever you want to dive deeper into certain treatments and surgeries, it's literally like filmed and blogged in
so
great
raw
detail.
and authentic and
Oh yeah, I
real.
would do it on the spot. I'd come home from treatment and like log my side effects and log how I felt and like log the day and how it happened. Like it's a real vlog of like back in 2013 when I was going through it. So it's all there. If I made a mistake, my bad, because I again feel like I repressed it. And then I did radiation, so 29 rounds of radiation. And for me, that was like even more brutal than chemo, just psychologically, because you go into radiation like alone. No one can, you know, be there in the room with you. Like obviously someone can accompany you in the waiting room, but it's also like, it's not once every 3 weeks like chemo was. It's like every
Daily,
day.
right?
Yeah. Yeah. Like it's like a job, like Monday to Friday. Every day, and you go alone, and it's so isolating because like especially for me it was like in the chest, so like you have to hold your breath. People are on the other side of the window because they don't want to get any effects of radiation, which is again like what you're saying.
Crazy.
It's like, why am I here? Yeah, it's like, why am I under
walls.
this machine when you guys are like escaping and there's like that caution like light that's like, do not enter. But you're there left alone on the table like, okay.
It's not funny, but I'm just like,
No, I know though.
you know,
But
it's
like,
just wild.
those are the things that were going through my mind when people would like run out of the room for their safety. It's so bad.
Wait, now that we're telling bad jokes, can I share something?
Yes.
So remember when we were at Miami Breast last year, and I've never had radiation, so I'm totally clueless. So Nalie, you know, has this like hot leopard bathing suit on, and I was like,
my god.
oh, you have a birthmark right there. And she's like, no, this is not a birthmark. This is
I'm like, bitch, this is a radiation tattoo, okay?
And I felt so stupid.
There I am trying to be all confident and sassy in my cute triangle
And you
leopard
were cute.
bikini.
I just thought,
And I'm like,
I was
no one's gonna
that's
notice
a really interesting
my
place to have a beauty
scars.
mark.
Straight up and I was like IG storying like, hey guys, here I am on the beach in Miami, and then Steph's like, hey, is that a beauty mark?
I thought it was a beauty mark. I just thought it was like an interesting place. I was like, oh, that's cool. Is that a beauty mark? Okay, sorry.
Radiation
Sorry.
tattoo is
Radiation tattoo.
I'm sure
I'll
a lot of
never
you
admit that.
listening can relate, but
Yeah.
yeah, they are still on me. It's just a tiny little mark, but yeah, Steph notices everything apparently.
Sorry, I didn't mean to
That's
offend anyone. I
not
just didn't. I didn't know.
No,
I had
and
no
you gotta
clue.
laugh about these things. That's like, I think if you want to
We
insert
definitely
some
laugh.
tips in between, you gotta laugh.
Yes.
So 29 rounds of radiation that completed. Once I completed that, was pretty much considered cancer free because they had removed the local area because I was diagnosed with stage 2 ERPR, hormone positive, basically breast cancer. And so even like when I asked my surgeon, I'm like, when can I be considered like, you know, cancer free? Because I was stage 2 at the time. He was like, well, you know, since it's local, like once the local area is removed and then like technically you're already cancer free. But then I wanted to complete all the treatments. So I remember declaring it on like my last day of radiation. And then I was put on tamoxifen. And then I was on tamoxifen for 3 years for prevention. And then if you listen to episode 1, you know that I had a cough, which led me to the ER, which then led me to doing an x-ray, which then results lit up and showed that I now had cancer in both lungs. So, which equals a metastatic stage 4 breast cancer diagnosis. And I did the whole biopsy again, and which then proved that it was still an ERPR diagnosis, and that it basically confirmed that there was still cancer cells and that it had spread, and now it's in the lungs. So when I found that out, which is crazy because it was 3 years ago on January 6th, again, once the biopsy results came in, they knew that I had to restart the same type of chemotherapy. So speaking of the Red Devil, I did it again.
Again. Yeah. Oh my gosh.
And almost immediately after that, like in January 2017, I restarted it. And then again, within 2 weeks, 14 days later, on the 14th day, my hair started falling out. And I think I did 6 more rounds of that. This is another thing that I don't think I even counted at that point, because I was just like in my what the frick mode, you know, like I can't even believe I'm like this is like it's almost like a blur to me. And then I think I did a combination of AC combined with Taxotere. And then after I think I hit my limit of amount of AC you can do in your lifetime, that's how harsh it is, you know, like it can actually like you can't do a certain amount. I can't remember what the number is. And so I reached my limit, and then I did just Taxotere for a couple more rounds. And then thank you God, the results were showing that the nodules were significantly decreasing enough for me to like, I was breathing greatly. My oxygen levels were amazing. Like I didn't have the side effect which led me to the hospital in the first place, which was a cough and shortness of breath. And so it was enough for my oncologist to be like, okay, let's stop chemo and let's move on to hormonal therapy, which hopefully will keep everything, stable and at bay. And so I was prescribed with Zoladex, which is to put me make me menopausal. And
so
then
Zoladex, sorry.
I feel like Zoladex is like Lupron.
It's like Lupron. Okay.
If and I don't know, correct me if I'm wrong, anybody listening, all the health professionals. I think it is. I know, and I did Lupron when I was trying to preserve my fertility, and when I was undergoing chemotherapy the first time. And then I don't know why this time I was given Zoladex and not Lupron. I don't know if it's just, are these brand names? I don't know. That's like a quick Google search we can do, but yes, the purpose of Zoladex is to make me menopausal. Okay. And then accompanied with Zoladex, I think if I remember correctly, I started with letrozole, and then I was on that for a couple of months, I think 6 months even, and I was doing scans every 3 months, right? So every 3 months we would do a scan, and I think for the first year or so, or a little bit more, I was stable. And then the moment that results started to show a bit of progression, and it was always minimal progression. I'm not talking about and I never even started coughing again. Like I had no side effects whatsoever from the cancer. It was really just, doing scans every 3 months that, comparing the images closely and seeing like millimeters of growth, that it was enough for my oncologist to be like, let's be proactive and let's switch you to, I believe it was like Arimidex. And then I think I went through all of like the oral pills, like hormonal pills used for metastatic breast cancer, ERPR positive. And I slowly kept going through them. I don't know if I don't know how many there are, but I know I did letrozole and then Arimidex. Okay. Or Aromacin, or is that the same thing?
I know
Again,
what you're saying. Yeah.
again, it's brand names versus, it's kind of like Ibrance and then palbociclib.
The
It's the same
scientific
thing.
name
Yeah.
and
The name of the drug and then the brand name of the drug. So sometimes I'm not sure, but let's just say, as like in summary, as like results were showing minimal progression, my oncologist was switching me up to see which hormonal oral pill would be better to keep things stable. And then finally it came to a point where he believed Faslodex was like the next best thing. And so I was doing Zoladex and Faslodex. And then I met Stephanie, who told me about Ibrance. And then I was like, oh, what
I
is
think that was
this
like one of the first things I asked you. I'm like, why aren't you on?
Yeah.
So
or how come I think I saw that you didn't lose your hair, and I'm like, but then how are you cancer free? And like, what did you like? I think you were NED, sorry, at the time, right?
NEAD, yeah.
NEAD. Yeah, so you had no evidence of active disease, and I was like, okay, what did you take? You have your hair. How come we have the same diagnosis yet we're not on the same treatment? And that's when you had mentioned Ibrance, and that's why I knew it was in 2016 that you started, because then I had the recurrence in 2017, and then you were telling me about it, and it wasn't approved in Canada yet.
Right.
How crazy, right?
So crazy.
And then,
and I think it's really quick, like important to say that Ibrance is in like a new class of drugs called CDK4/6 inhibitors.
Mm-hmm.
And they are specific to metastatic or heavily pretreated ER positive, HER2 negative breast cancer.
Exactly. And I don't think it was approved yet in Canada. And then when it was, I remember my previous oncologist that I had started with since 2013 didn't really he was iffy about it because it's so new, right? And he didn't have like the statistics or there are no survival rates to prove it because it's just so new. So he was a little reluctant in prescribing it to me.
A lot.
Yeah. And rightfully so, because when I took it, my white blood cells and neutrophils in particular dropped tremendously and faster than like Steph's would, because Steph and I would always compare each other's blood test results, and compared to your average patient, my neutrophils were just like dropping dangerously low. And your neutrophils are the part of your white blood cells that is in charge of fighting off infections and viruses. So my oncologist was like, this is dangerous for you. So he just right off the bat marked me as intolerable and had me continue just Zoladex and Faslodex. And that's when I was like, okay. So I wasn't really on any active, treatment aside from hormonal blockers for a while, like a year, no? And that's when I started really exploring, alternative and complementary therapies that we discussed in previous episodes, because I was like, okay, well, I'm not doing any chemo. Like, let me try something else. And I tried different diets, and I tried, all of it.
And you had hit your limit too, because even you couldn't do the harsh chemo again.
No, exactly. And then I didn't really want to, because if my neutrophils are already taking a toll on like Ibrance, imagine what's going to happen if you take like this heavy duty chemo that kills your white blood cells. So that was a really troubling time for me, because there was just so much uncertainty. But again, I was thriving. I was feeling great. I had zero side effects at that point. And then, my gosh, what happens here? Oh yeah. And then I think I pushed hard for Ibrance again, right?
Well, I think what happened was we went, we finished Nalie's story for her.
Oh my gosh. Well, this is where you took
driver. Yeah, co-pilot.
You really swooped in and helped me, which is why you should definitely take the mic right now.
So we went I wanted to get a second opinion, and so you came and saw one of my doctors here in New York, who said that he was telling us about there are new CDK4/6 inhibitors in addition to Ibrance that are coming on the market. And a few months later, actually in 2019 in March, I spoke at the Miami Breast Cancer Conference. I was the keynote patient speaker. And we had that pamphlet in our room, and we kept seeing Verzenio.
Yeah.
And I was like, oh man, look at this new drug, Nalie. Like, this seems like it'd be perfect for you, And I don't know why, for some reason that drug, really, we were curious, and I think we asked some questions, and you took that pamphlet home. I
Yeah,
was like,
I
take this
still have
home
it.
and go ask your doctor about this drug. And
But
I
even
think,
at the Miami Breast Cancer Conference, we spoke to even another oncologist from Los Angeles. Like, it's the conference where all oncologists around the states gather and learn and discuss, what's in the pipeline. And everyone was telling me that it wasn't available in Canada yet. So I knew it wasn't available in Canada.
but divine intervention. And so I think at that time, 2 more CDK4/6 inhibitors were added to them. It was Verzenio and ribociclib.
So
And
and
these-
Verzenio, by the way, is abemaciclib.
Okay.
So there's
when you
palbociclib, Ibrance, ribociclib, I don't know the brand name, and then Verzenio is abemaciclib, which are all part of the CDK4/6 inhibitors.
And
why do we know this? Lord
I don't
Jesus.
know. And I even want to go deeper. And I'm like, and Verzenio has a path 2
Yeah.
antigen or something. I don't know. I read about that. But anyway,
Oh my God.
when you went to your new oncologist, he found a way. And
Yeah, well, for one, he was like, I still think Ibrance is the best drug for you right now until there's this new drug called abemaciclib, aka
we were
Verzenio,
like,
that's
oh my
coming
God, that's
out.
the drug
Yeah.
on the
And right
pamphlet.
upon my first consultation with my current and new oncologist, he was like, we'll put you back on Ibrance until this new drug comes out. And then, and Steph and I were like, oh, we know this drug. It's called Verzenio. And then, so I went back on Ibrance, but then a lower dose because we all knew that the 125 was just.
What were you taking? Just curious. When you took the lower dose.
100.
Okay.
Yeah. And even the 100 was, again, making my neutrophils drop like really low. And then, but then when I got my first scan at my new hospital with my new oncologist, there was still like a slight progression. And then my new oncologist was like, because you're such on a low dose of Ibrance that, we're not going to see significant results immediately, so it's only normal that you're still seeing a bit of progression. And then, that day when I came for the scan results to see a little bit of progression, he was like, guess what? I was like, what? He's like, what did I tell you the first time I met you? And I'm like, I don't remember.
I think you're going to live till you're 100.
Yes. Aside from that, I'm going to live for about till I'm 100. And he was like, well, that there's this new drug that's going to be approved soon in Canada, which is the drug I wanted you to be on, got approved yesterday, which was the day of my scan. And then he's like, I want to get you on this, and you're one of my first patients on it. And in fact, one out of like 20 patients in Canada to even be on it. And
Wow.
so I started Verzenio. This was summer of 2019. And then my first scan, only after like 2 months of taking Verzenio, finally showed regression.
Her first scan, like in 2 years, where we saw regression as soon as she started this Verzenio.
Yeah. Oh my gosh, so surreal,
Verzenio.
like saying this. Yeah. And then I have my next scan on with Verzenio, and I feel very confident about it. But
Me too.
it's right around the corner in February. So we'll see. We'll be able to update you more on the results of that. But I guess, like, in a nutshell, side effects of Verzenio is a lot of like digestive issues, aka diarrhea. And I'm not used to having like side effects, kind of like what Steph said too. Obviously on AC it was a different story, but then, like, as I had mentioned, it was thankfully, I've been sailing through all of these hormonal therapies, and even Ibrance, I didn't really, aside from hair thinning, I didn't really, and a bit of fatigue, but still, like, we have our ways of coping. No, I never really experienced many side effects, and this is the first time, and I guess it's because I'm also like on a heavy dose of it. I'm on the highest dose, which is, highest dose possible in combination with Faslodex, is 150. And so, my stomach's been like, woo! It's been a journey, and I'm still trying to figure out
ways to eat.
Exactly.
Right?
Things that are affecting my stomach on Verzenio, and that I'm learning to, avoid or add more to help. But yeah, that's where I'm currently at. So in summary, I am on Zoladex and Faslodex with 150 is it milligrams?
Milligrams.
Um,
Yeah.
uh, of Verzenio twice a day, a pill in the morning and a pill at night, and that is my current treatment.
Woo! I need a drink.
Jeez.
I don't even drink, and I need
know.
a drink.
After that, I need a shot of tequila.
Pour myself a glass of wine. Wow. I think,
Yeah.
you know,
That was a
like,
mouthful. And like,
we've been
again,
through a hell of a lot. Like, I have to
Yes.
say, like, sometimes it's like it's our own story, so we just keep on trucking along. But when you like take these moments to sit back and reflect, you're like, shit.
Wow. Yeah, that's where
Yeah.
like the gratitude kicks in like crazy. It's like,
super gratitude.
thank you, body. Thank you, lungs. Thank you, immune system. Thank you, gut. Like, oh,
Yes.
you poor thing, you know, like you've been through so much. I definitely want to treat you right. Like, I feel like that's what is my main motivation of thriving.
Yeah,
right?
and
Like being
heal.
kind to your body.
Yes. Amen. Wow. Wow.
I know. So
Jeez.
after hearing all of the drugs we've been on, my one question, I guess I want you to answer just because out of curiosity, what do you think is the one thing that like helped you? Because you kept saying that you didn't have many side effects and that made you, you know, thrive. What helped most? Out of all those drugs
Honestly,
you've been on, and like not even the drug in particular, like what did you do to get through all of that? Because it's a lot.
Well, that's a super loaded question because
Yeah.
I've done so many things. But I'm not going to sit here and name like, oh, well, I took this supplement and did this. I would say I've done a million things, and we did talk about some of it in earlier podcasts. And as Thriver Talks unfolds, we'll definitely reveal a lot more, and our book is going to reveal all.
Yeah, in detail.
But I would say, as cliche or as this may sound, like your mind is so freaking powerful.
Amen.
And I think over anything that I took, I always say, as crazy as people may think I sound, that like your mind is more powerful than any treatment you can take, Western, Eastern. So I always just in my mind was, you know, I'm going to keep living. I'm going to keep living my life. Even when I felt like shit and couldn't get out of bed, I would make myself kind of get out of bed. And I'm not saying that this is the right thing to do, but just do something little. Like, you know, I wanted to keep doing and being. And I think just my mindset, like every negative statistic that they told me or told me that I couldn't do this, you're never going to be able to use your arm because of your lymph nodes. It's like, I kind of just challenged that and always believed that I was going to defy whatever the odds were, whatever they put against me. So I guess in a really roundabout way of answering your question, I would say is like working on your mind and your faith, and believing and knowing what your body is capable of, and the power of your mind is so much stronger than we ever give it credit for.
100%. And I would say the exact same thing. And even just to add on to that is believing in your treatment. So
Yes.
whether you are
Great.
getting the AC injected in your veins, and even instead of calling it the red devil, you call it your red angel. You know what I mean? And you
Amen,
take it, and you take it with complete faith that it's doing its job, and you visualize and you meditate and you direct the medicine to go straight to the cancer cells where you need it, and you bless your pill before you swallow it. I think that's what really helped us undergo all of those medications quite smoothly, I would have to say.
Wow.
Right?
That was beautiful. Yes, you couldn't. I couldn't have said that better. I mean, it's so true.
And with a stage 4 metastatic breast cancer diagnosis, they say that you will be on medication for the rest of your life. But as thrivers, Steph and I have a different belief.
Of course. I mean, and this probably pisses people off, but these are our beliefs, and I don't really care.
And you are actually headed in that direction.
Right. It's
as
like
our official guinea pig.
Okay. I'm currently, which I'll disclose some of it later on, but I'm working on a plan to wean myself off a lot of the stuff that I'm on.
Mm-hmm.
And yeah, I foresee myself one day being off of treatment.
Same.
And I know this would probably ruffle people's feathers, doctors, but this is what I see for my own body, my own self, Stephanie Seban. this is what I see for myself. And that's what I'm working towards.
Amen.
And not to say that I'm the only one that has done this. You know, I always say it's like we always hear a lot of like the worst case scenarios, but there's so many stories of outliers and people who had these crazy diagnoses given a short amount of time to live, and they're totally alive and well off treatment, living their lives today.
Yeah.
So
Yeah, I have.
seek
If you're
those.
from Montreal, this woman from my previous hospital is in her 60s, and she's stage 4. She had it everywhere, all around her body. Her name is Maylin, and she is not on any medication anymore, 0, and she's in complete remission, and it's been like 9, almost 10 years. Actually, I think she hit her 10 years.
Wow.
And she's older than me, you know, she's like 60. So
Goals.
yep.
Those are my goals.
And that's what we believe, and that's Steph and I's vision, and that's something we hope, you know, we can, that hope that we hope to share with all of you.
Is dream big, believe big, you know, like as with anything in life, you know, even if people think you're crazy or, you know, think you're misleading or giving false information, it's like, this is my body, my decisions. This is what I believe and see for myself. Same for Nalie.
Yep.
And there's no reason why you can't have these same beliefs for, you know, my faith is bigger than science. My faith is bigger than anything. So I believe that these things are possible, and that's what I'm working towards.
Tears.
Oh, and as I'm looking at, I just saw 11:11.
Oh wow, yes.
On the time of our call. Yeah, right when we said that. So, yes, that is my piece on all of this, and I really, really, really believe, and sometimes believe isn't a strong enough word. I know that all things are possible. So that is it. Is there anything else you want to say now?
Man, I think we nailed this one, and I'm happy that I could send people to this episode to listen to.
Yes.
You know, our whole conventional treatment plan, because it's something I don't like, you know, reflecting on or saying, and like I literally have a nasty taste in my mouth right now. So I'm happy we did this. I'm happy it's here, and I'm happy it can serve. And we really hope that this episode may have given you, you know, maybe you didn't know about Verzenio, maybe Ibrance, or all of those chemotherapies are things you never heard before, and it's something that, you know, you could suggest to your oncologist or speak to someone, or I don't know, just hope
or
that
even if you're like starting a new drug and afraid, it's like, okay, well, I've been on Ibrance 4 years, you know, and Nalie did the amoeba, what's it called? Attack twice. That the Red Angel.
Yes, the Red Angel.
Twice. So all to say that, you know, I hope our stories can provide some hope and inspiration
and serve you in any way.
Amen. So thank you as always for tuning in and listening to our episode. Please subscribe. We're available on all major podcast platforms. And we're recording Thriver Talks as we write our book simultaneously. So if you haven't already, please sign up for our newsletter. It's www.thethriversguide.com. And most importantly, if you know somebody who could benefit from this message or be inspired by this message, please share this episode with them.
Yes, please. And don't forget, where there's a thriver's will, there's a thriver's way. We'll talk to you guys in the next one.
See you soon.
Bye.
Bye.